All right, and again, good morning, everyone. We're just giving folks a couple of minutes to hop in, and then we'll do our usual thing, our introduction and so on. I see some folks already saying hi in the chat. Thank you. Just want to encourage everyone to post your information in the chat, who you are, what organization you're with, if you're with an organization, or what brings you to the meeting. And then if you feel free to post your contact information if you'd like folks to contact you outside of the meeting. Good to have you all. Again, we'll get started in just a couple of minutes. We'll go ahead and get started and for the folks hop on. Good to have them, but good to have you all. Good to see everyone. So my name is David Pattis. I'm the project coordinator for the ConnectOC Coalition. We're a program of Partnership for Wellness in partnership with the Orange County Healthcare Agency. It's good to have you all again joining us for our February 2024 meeting. I want to encourage everyone again to introduce yourself in the chat. Let folks know who you are, if you're with an organization, what organization you're with, or what brings you to the meeting. And if you'd like to have folks be able to contact you outside of the meeting, feel free to share your contact information there. I'm excited, especially for our topic and for our speaker today. So we've been thinking for quite some time of covering the topic of human trafficking and wanting to think through in what ways does this subject matter intersect with what we're doing for the ConnectOC Coalition. So by way of reminder, the ConnectOC Coalition, our focus is promoting existing mental health resources to youth and young adults here in the county, ages 12 to 24, so that folks have a better sense of what's out there and a better sense of how to access them. As many of you, I'm sure, are well aware that there are many fantastic resources available to us, either directly here in the county or accessible to folks in the county. And one of the major gaps in services that people encounter is simply not knowing what's out there or knowing how to access it. So that's our focus here at the coalition, is helping folks better understand what's available to them and make use of it. So again, today our topic is going to be the intersection of human trafficking and youth and young adult mental health. And our our speaker today is Linh Tran with Waymakers in the Orange County Human Trafficking Task Force. So I'm going to pass it on to Linh. She's going to introduce herself, tell you a little bit about the work of the task force, and a little bit of information about human trafficking in general. I think human trafficking is a subject that's really easy to assume we have a good sense of what it means, but there's a lot to it that we may not understand well, and Lynn's here to help us better understand it. And then we'll go from there. We'll have a good conversation. So Linh, thanks for joining us.
Good morning, everyone. Thank you for being here. So I'll start off just very quickly before we go into the question part related more to mental health. So if you are new to this topic of human trafficking, just kind of lay the foundation what human trafficking is, what the task force is, how we are responding to human trafficking here in Orange County, what our victim survivor numbers and data looks like, and we'll focus more on the victims and survivors for the purpose of this meeting in time. My name is Linh Tran. I am the task force administrator. I'm with a nonprofit here in Orange County called Waymakers. I work under the Victim Assistance Program, and under the Victim Assistance Program, we work with victims of crime in Orange County and help them navigate through the criminal justice system. And Waymakers is also not only the lead victim service provider for the Orange County Human Trafficking Task Force, but we co-chair the task force along with the lead law enforcement agency, which is the Anaheim Police Department. But the task force is actually a collaboration of about a good 60, 70 different organizations, from government to law enforcement to nonprofits, to kind of address this issue here in Orange County. So it's a very robust robust network of different types of collaboration addressing different issues. When we created the task force, even though it started very small and primarily with the law enforcement arm and the victim services arm, it grew is because every single time we learned something new, we identified a gap in a resource need that we needed to address. And then we brought in collaborative organizations, and it was meant to be a multidisciplinary collaboration of different organizations. So I've been in this position for 14 years. And so, we learn as each year grows. And it's been an amazing, I think, journey to see what we've been able to do and develop in terms of this work. So the task force objectives really is to address protection, prosecution, and prevention. So again, going back to every single time we learn something, we identify, okay, the gap in the service need, the new education, and then reach out to those who may be experts in that particular field, right? And what we do find very quickly is that someone may be an expert in the field of healthcare or mental health, or domestic violence shelters, but it's a gap in education, human trafficking that usually stumps people and how to make that connection. So what honestly, we learn the most from our victims. So they're the ones who educate us, and then we go out and figure out what it is to go educate the others in the other fields. So the basic definition of human trafficking, and this relates, it's federal definition and California definition is similar, but I'm really going to focus more on California definition because that impacts us more here in Orange County in California to go under the California definition. So human trafficking is the deprivation of a person's personal liberty using force, fear, duress, coercion, threats for the purposes of either commercial sex or forced labor. So under human trafficking, you have either sex trafficking or you have labor trafficking. For sex trafficking, it's usually, we're talking about forced prostitution of an adult, or it's any commercial sex act with anyone under the age of 18, so a minor. So when you're a minor and you're involved in a commercial sex act, which typically is connected with prostitution, you do not have to, you do not need elements of force, fraud, or coercion, duress. It is automatic just by age, and they are identified as a victim. This is a change to where it was before in the past. So in laws also has changed. So kind of give you perspective of where we are in our mindset back then to where we are today. In 2017, California changed the law so that if you are a minor, you can no longer be arrested and charged with prostitution. Prior to 2017, that was a possibility. So that says a lot about where we are and what we thought about who victims are. But that is very specific to California law. And so that's great for us here in California, but it doesn't mean that those laws have changed in other parts of this country. For labor trafficking, you're looking at things like elements of involuntary servitude, indentured servitude. So indentured servitude could be things like somebody, and typically almost all our victims are from foreign nationals. So they're coming from outside the country, and into the labor trafficking here. So indentured servitude could be a situation where they owe money to their trafficker, and they have to work it off through some form of forced labor, and they find out they cannot pay it off because of the things that it comes along with the debt bondage. So that could be a form of labor trafficking. And so labor trafficking, you do need for a minor, with the difference with labor trafficking with a minor versus sex trafficking with a minor is that for labor trafficking with a minor, you do need elements of force with a minor, because minors can't technically work. And so you have to have those additional elements of force with a minor. So that's the basic definition of human trafficking, and to make sure that human trafficking and human smuggling are not the same. So when you talk to people out there, because of the lack of education, people assume trafficking or smuggling is the same. So just to clarify, human smuggling is a crime against the border, a national border. And it's usually transportation based, moving one person across the border into the other. Human trafficking is not a crime against the border. Human trafficking is a crime against the person, and it is exploitation based. And so when you hear about human trafficking, again, because of lack of awareness and education, I think with a lot of people still, today, that people get confused what human trafficking is, what human smuggling is. And also there's confusion that human trafficking is only sex trafficking, and in fact that labor trafficking also exists. Human trafficking is a big term. Underneath it, you have sex trafficking and you have labor trafficking. But the purposes are the same, whether it's sex trafficking or labor trafficking. The purpose why human trafficking exists is about money. This is about a business, about supply and demand, and they're making money off of it. So for sex trafficking, because it's usually really prostitution, they are making money from the exchange of the sex acts. For labor trafficking, it depends on the situation. Like they could be taking forced labor from somebody and they're using that forced labor to make money, or let's just say in a domestic servitude, indentured servitude, where the workers inside the home, they may not be making money off of that worker by having that worker go and work somewhere else to make money, but they are saving money by not hiring somebody to do the work with fair pay, wages, and things like that. So everything at the end of the day is about money. So in terms of what it looks like here in Orange County and the stats, I'll give you a rough idea. We have since in a 10-year period, let's say between 2010 and 2020, we've had assisted victims from 39 different countries, including the United States. But where we stand today, the vast majority of our victims are American victims. So in 2021 and 2022, 85% of the victims and survivors we assisted are American victims. And we're looking, so breaking down from the most to the least that we've seen so far, it's female adult sex trafficking victims at 51%, female minor sex trafficking victims at 32%, female adult labor trafficking victims at 5%, male minor sex trafficking victims at 4%, male adult labor trafficking victims at 4%, female adult sex and labor trafficking victims at 2%, transgender minor sex trafficking at 1%, and transgender adult sex trafficking at 1%. So it's, again, the vast majority are going to be female. For sex trafficking, the vast majority are Americans and minor Americans. And for labor trafficking, it's going to be foreign nationals. But that kind of gives you an idea of what it looks like. But let me break it down a little bit so you see what it looks like here in Orange County with the minors. Over about a 12-year period, we were tracking, as we're learning this and we're getting more educated and identifying more victims. Early on, before social services came, was part of the task force, most of the victims were getting identified, with sex trafficking in particular, were getting identified by law enforcement. And so we saw a lot of minors from outside of Orange County being brought into Orange County for purposes of prostitution and commercial sex. When we started educating our local community and our local agencies, especially those who connected with child welfare services, we actually saw an increase in Orange County victims being identified. So where it stands today in this 12-year period is that 70% of our sexually exploited minors and victims are from Orange County, and then 30% are from outside of Orange County. So for the 30% that are from outside of Orange County, they're coming from 22 different counties across California, 18 different states across the United States, and 4 different countries. So that's kind of what it looks like here. So in terms of context of the numbers, and people, when I do presentations now, I'm glad when I ask, well, are you surprised that there are so many American victims? Back in the day, everyone raised their hand like they're very surprised. Today, I'm glad that there's more awareness and really no one is surprised anymore. But when you look at numbers, the part is the context is that, well, we knew there was probably going to be more American victims. The percentage breakdown is very big between Americans and foreign nationals. Part of the reason is because awareness and more education, and part of it is because the task force has a lot of proactive law enforcement, and so law enforcement has concentrated a lot in identifying places with American victims and minors in particular. And so what they're looking for is what they're getting. That's why those numbers have increased. We do know that there are probably more foreign national victims out there, but we haven't been able to get those coming in yet. And part of it is that we know victims do not self-identify, they're not seeking help. So that's why we have to increase the awareness out to the community, these agencies out there who may come across victims and they themselves don't know, and to make that connection. So I'm going to stop right there in terms of kind of giving you an overview of what it looks like here in Orange County, and then I'll pass it back to you, David, for the questions.
Yeah, thanks, Lynn. So first off, it was a great summary of it. There's a lot of um, the data itself and the context behind the data really helps, I think, give a better sense of what the actual issue is or where the issues lie. And I'm wondering, yeah, Francisco, I see you've got a question. Feel free to hop in. Which question?
Yes, thank you. And Lynn, thank you so much for that education. Really great. For me to better understand kind of like, human trafficking. Have over about a year and a half working with human trafficking victims and survivors. So I could definitely relate to a lot of the things that you mentioned. I had a question in regards to the minor. You mentioned minors can be arrested for prostitution. Um, from my understanding, because I used to work with mainly adults, I know that due to 2017, you mentioned that that law passed, and pretty much from my understanding, they can't be arrested or it's not a crime for the adults to be in a sense like loitering or how do you say advertising, right? Like they
Yeah.
can't be picked up or be cited for any of that unless there's an actual transaction being made, and at that point, that's when a crime occurs. But
Yeah.
my question, because you mentioned minors, um, if a minor does commit the crime and does do that transaction, is it not a crime? Can you better explain that for me, just so I have a better sense? Just because with our program here, we're the minor victims assistance sanctuary in Santa Ana, and we work with minors that are victims or at risk youth that are at risk of being a victim. So I'd like to just kind of better understand that, for our program's sake and moving forward for my knowledge.
Yeah, I mean, I'll do the best I can. I'm not a legal expert in this.
Yeah, no worries.
Yeah,
Yeah, I
yeah,
appreciate you. Yeah.
yeah. So you're talking about two different ones. So there's one that was the loitering. That's different from prostitution.
Right, and
Yeah,
the
yeah,
act, correct.
yeah. So the loitering is loitering. So basically, the newer law that passed is that this applies to regardless of age. If you, and this applies mostly on the visual of activity, prostitution activity on the streets. If you're standing there and it looks like you're dressed a certain way and it could be possibly involved in it, that in itself, not necessarily it's legal, but it's not
Mhm.
illegal either. It just
Yeah,
criminalized it, which means you can stand there, and then for law enforcement is it's really difficult for law enforcement to go up because you can't do anything about that
right.
unless you can prove the actual transaction was completed, right? And so, there's a lot of controversy around that because now because we have heard that there's a lot more activities across all of California because of that.
Mhm.
Um, the prostitution is different. So, if the completed transaction between the minor in exchange of sex act and money or something of value, that as a complete transaction, they cannot be arrested and charged with
Okay,
prostitution for that. Yes.
gotcha. Thank you so much.
You're
Appreciate it.
welcome.
Just wanted to get the
Yeah,
clarification with that. That's really good to know. Thank you. That was my only question.
you're welcome.
Thanks, Francisco. Um, so so Lynn, I think maybe this is a good actually transition point to my kind of first question for you, one we talked about just before the meeting. But in the community mental health world, we are ever aware of the importance of language and the implications of language and the possibility of language carrying stigma and that kind of thing. And I know that I've heard folks use in reference to, and during your presentation, to those who've experienced being trafficked, use language of referring to them as victims and also as survivors. And can you help kind of sort that language out for us, and if there's a preferred term or
Sure. This is something doing this for 14 years. I feel like it's an ongoing conversation. What's the right word to use? And honestly, it depends on their process in their journey. And what is difficult for the service providers is that you don't know what their process is and what their state of mind is. So then you're like, well, I don't know then what the word I should use. Do I use victim? Do I use survivor? Do I use as a third party references person? Well, I can say this as a victim service provider, when we talk to our victims or survivors or clients, we don't use any of those stuff because we call them by their name. So, again, part of it is like so it's more of like when you're talking to other service providers as what's that, do we call them victim, client, or survivor? We use all three. So,
Mm.
and again, it depends on their situation, right? So meaning from a program perspective, if they're enrolled in a program, we call them a client, just like anybody else. However, that gets tricky too, because in the world of prostitution, client may not be the word that they like to hear, right? And then things like the victim, there is this, there is, a lot of people say, well, I don't use the word victim because there's association to they're weak, they're vulnerable, and things like that. And I said, I do understand, but we also talk to our clients or victim survivors, and they are okay with using the word victim. And it kind of depends on their point in time, because part of what we don't force the word on them. If they don't recognize that they are a victim, we don't force it on them, right? But sometimes they don't understand that so for me, when I say victim, it has nothing to do with the context of weakness or vulnerability. From a victim services program, something bad happened to you, and that is that acknowledgement. Like, you are a victim of domestic violence, you are a victim of carjacking, you're a victim of assault, something bad happened to you, something, so that's part of that transition where they don't understand that. Again, but if they don't recognize that, we don't force that on them. And sometimes we also talk to clients, because we also get a lot of value feedback from our own clients and say, well, what do you think of the word survivor? Because the movement seems to be very big on survivor, survivor, survivor. And a lot of them also, I don't like that word either. I'm nowhere anywhere near that. And also the pressure of, like, I'm supposed to, be the survivor strong. I don't even, so again, it kind of depends. What I do say this is, when we're working with other service providers, give each other a lot of grace. We all are very well intentioned, wanting to help. If we use a word, it's not meant to be something bad. Again, it depends on the point of view of who you're working with in their journey, and their journey is varies. So what we do say a lot is that meet them where they're at. So where they're at in their journey is what we use in terms of their language that they feel comfortable with, because that language opens the door for so much more help. That rapport building language is where they are at.
Yeah, that's really helpful. And it resonates well with, in the mental health world. And I think in general in the services world, right? Good advice is always use the language that the person you are supporting is using, right?
Mhm.
Adopt their language and test language out. How does the term victim sit with you? How does the term survivor sit
And
with
another thing too, in terms of the terminology, is that, in the legal system, in criminal justice system word, they can't write survivor. You actually have to legally write the word victim. So
Mm.
again, so those are things that I think people don't understand. Like, this is not about, like, where I'm randomly just using this word for arbitrarily. There's sometimes
Mhm.
behind why a word is being used.
Yeah, it depends on context.
Yeah.
Sometimes that is the word, right?
Yeah.
Yeah. Yeah. That's really helpful. Um, so so making the shift to a little bit more exploring the intersection of human trafficking and mental health, some of the conversation that you and I have had, Len. Um, maybe a starting point question. What are some of the ways the experience of being trafficked impacts uh, that person's mental health?
That's a great question. This is where I'm loving this connection that you're making with us, Stava, to the mental health, because we really need the support coming from, from those who work in mental health. And sometimes we feel like we're running around in circles, because we're addressing something. But many of the subject matter experts within healthcare mental health is not where I think we would like them to be at, because mental health is a very big issue that we're dealing with right now. And we want to connect them with therapists and mental health specialists. However, there just are not a lot who specialize in this field to know how to work with them. And so we are reluctant to make those referrals over, because because they don't trust a lot of the services. And then our victim advocates and case managers are not trained professionals in mental health and therapy. But they trust the case managers, mental health the advocates, is because we're just trained on specializing in human trafficking. So we know how to provide emotional support, but we don't know how to provide the extra level of care beyond just emotional support. So what we learned over the years, at Waymakers, prior to the human trafficking program, we had the domestic violence programs, the sexual assault programs. So these are programs that was already built in place. And we started working with human trafficking. We thought, well, okay, we'll just merge into these other programs, and you would think that the easiest connection would be with the sexual assault victim services program, and we found out really quickly it didn't work. It didn't work for our victim population, and as we started to learn more about that, we understood why it didn't necessarily work, and then over the years we realized that that they actually mirrored more to domestic violence victims, at least in many regards, and sexual assault victim. Not to say that it doesn't, but then we also learned child abuse victims. So what you see with human trafficking victims is a combination of multiple victims into one. So you have a child abuse victim, you have a domestic violence victim, you have a sexual assault victim. And so what we deal with on the very tail end by the time you become a human trafficking victim is a lot of unaddressed mental health and trauma. And so when we work with them, one, they don't want anything to do with therapy or mental health because it was unaddressed way earlier in their child development. And when we talk to them, because they don't recognize themselves as a victim, we have to unpack things, and we start with, well, what is it that you do want to talk about? And the interesting thing is that they don't see the human trafficking as the worst part yet. What they talk about is that this is what happened in my childhood. All those earlier things that happened in their childhood, starting with a family dynamic, that's actually something that they would talk about. But again, it depends, right? And some just don't, because but the newer thing in the last couple of years that we learned, I would like to, I hope mental health field and the therapy field explores this a little more, and because we're starting to see this, is that there's one study done, or a couple studies done, that said that in terms of therapy and mental health, our human trafficking victims actually mirror the PTSD of war veterans. Because they have, so the argument was that similar to war veterans, they don't come back like, obviously, the PTSD manifests very differently. It's similar because war veterans have been in prolonged survival mode for a very long time. They deal with that on a consistent, but then it becomes normalized, right? It becomes normalized how they react to that survival on a daily basis. And so it's not uncommon for war veterans to return. They don't know how to be back in a normal life. And then it's common for them to go back into that because of that prolonged exposure to survival and life and death situations. So as I was reading the study, I'm like, oh, that is what we're seeing with our victims. It's just so normalized. And that's why they will see it, because it's normal for them. Right. And we're working with them on mental health, and, maybe people who want to go to therapists saying, I want to address the need, but, let's schedule a time next week at this time. That's not how it works with our victims. You can't just, they don't plan 1 week ahead or 1 month ahead, because they have stability in their life to be able to do that. So their mental health is just like, I'm just figuring out how to survive the next hour and the next day, and as far as it goes. So that's kind of where we start with. So that's, and in terms of the mental health, that's, we work with them with where we're at. The good thing is that when we learn how to address their crisis, get them de-escalated in the crisis space first, and learn to trust, whether it's law enforcement or the victim advocates or the social workers or case managers, that starts first with like, help me with the crisis. And then unpacking everything else later is really important, because now we're in this space where, okay, now we have our minors and we have our victims who are wanting to get help, which is a really difficult thing when we first started the work, because they just did not want any help, because they didn't trust anybody who can help them. Because nobody has really shown that in the past who could help them. And what we see now is that when they start unpacking all these things, because it is important at some point to unpack some of these things happening to them, because you're talking about like cycle of trauma and violence, right? Is that the field isn't equipped to be able to work with that. And those who are not in mental health don't know how to address that. And so the next problem that we start seeing very quickly is that they don't know how to deal with their trauma. So they're accessing drugs, because it is quickest fix to their problems by not thinking about what's happening and by going to drug. Now we have another layer of things that we have to address. But Francisco, I do see your hand up.
Thank you. And David, I do want to thank you for bringing up that mental health component, as it is a very key, how do you say, area that oftentimes, prevents a lot of these, survivors from or victims, right? To get the help they need and to be able to make the best choices for themselves moving forward, right? A lot of the times, as you mentioned too, Lynn, so they could get re-triggered or re-traumatized and they're not ready to, talk about that experience yet, right? The question I have, Lynn, is you mentioned Waymakers and the huge influence that y'all have here in Orange County. I'm curious to know, because I do have a case manager here that and myself for, domestic violence, like certified. We were able to take a training, 40-hour training that, helped, educate us on how to best work with these individuals and these, survivors. I'm wondering, if Waymakers has anything like that some mental health providers or any one of us here, in this room may be able to take as far as like an advocacy training for human trafficking to further educate. Is that something Waymakers offers, or is there an organization or an entity that you may be aware of that can, provide that?
Yeah, that's what we're trying to get more awareness to help with the funding to do more training, because that's really the need right now. And we do, it's just that we don't have the capacity to do as much as we want. And this, I think, where we bring all these different fields together, I think that would help say this is not just about the advocacy field and just the law enforcement field, mental health field, to increase in the training component of it. But we only do on a case-by-case basis, unfortunately, Francisco, when we
Okay.
offer it. And it's mostly advocacy around human trafficking. There's very little, there isn't a strong piece on the mental health piece of it. I mean, ideally in my world is that, at least for those who are new to human trafficking, at least it starts there with, okay, let's talk about really what human trafficking is. And then, have your mental health providers be there and like, okay, you all take that to help us with that next level. And that's somewhere down the road, it could almost be a co-partnership training, right? And so kind of learning from each other. And as you build your expertise in the mental health, and then us, kind of coming alongside you, this is what we're seeing. And then that's what we hope, in terms of how to expand that out to. That's what we've done with other fields too, with the law enforcement field, of what they learned before, and they learn new things. And then with domestic violence too. And sometimes, there is a correlation between domestic violence and human trafficking, but sometimes there isn't. And so I think those are the things where, like, where are the similarities and where the differences lie between all these different intersections between these types of crimes and victimizations.
Definitely. Thank you. Thank you.
Thanks for the question, Francisco. Actually, you did a great job in preempting kind of a further part of our conversation. One of the things, Len, you and I have talked about is you've talked about human trafficking being in many ways a new field, and there isn't a lot out there yet in terms of the training and equipping of mental health professionals to specifically work with this population. And this is an area for providers to really exercise some important humility around ways in which our current experience is just shy of what might be needed, right? Because many mental health providers might be experienced in working with complex trauma, maybe experienced working with any of the number of the populations you mentioned, victims of domestic violence, survivors of domestic violence, survivors of sexual assault, combat veterans, and so on. But human trafficking and survivors of human trafficking represent a distinct population where there can be any number of those parallel experiences at play, right? I mean, what I heard from you is somewhat by analogy. There are elements of domestic violence, elements of sexual assault, similar types of post-traumatic responses as combat veterans, but it still represents a unique experience and unique population. So it's important that we recognize as providers, our current experience may not get us all the way we need to go with survivors of human trafficking. And so there's some room here for identifying and beginning to address a gap by recognizing the need to develop some training. Maybe you could comment a little bit further on that.
Yeah, and also it's also complex because it's the human trafficking is so broad, the range is so broad, right? Because you also include labor in this too. And you have the cultural aspect of all victims coming off all these different countries. And so in addressing labor trafficking is not necessarily the same as addressing sex trafficking. So everything you take into account. One of the things in terms of mental health in particular is at least as a service provider, and that, well, how can I as a service provider training this help somebody who could be a human trafficking victim? One, I think just basic awareness would help, because once you do that, you will start to see that, oh, the clients you thought weren't probably, you missed something before, and it's no one's fault. It's the same thing with where law enforcement is now. For example, last week we did a training for our patrol officers, and we're teaching them all these new materials we're finding that, oh, I didn't see that before. We probably missed all these things before because we didn't know this new education. So it's the same thing. But as a service provider, what you can do, the way I explain it to a meeting with professionals in domestic violence is that it's closer to home than you think. So you're probably working with human trafficking victims, you just don't know it yet. And it's not this complete separate thing so far off that you can't relate to it. But in the field, you either have the resources or knowledge to know how, once you know they are a victim, what can I do moving forward with them, with the service provider for them, at the same time backwards for prevention, right? So a good way we talk about need for prevention and not just aftercare, quote unquote rescue, is that when we are working with this, it's almost imagine like the Gulf of Mexico, right? So at the beginning of where the Mississippi River is and it flows out to the Gulf of Mexico, I imagine at the very beginning of that river is beautiful, clear, clean water, and it starts going down the river down to the Gulf of Mexico, start collecting all this stuff, right? The dirt, the grime, and then it flows out to the Gulf of Mexico. And the human trafficking field teams be, let's go rescue these victims in the Gulf, and we're asked to clean up the Gulf of Mexico. And that's an impossible task to do. And so not just as a service provider cleaning Gulf of Mexico, that's also an impossible task to ask the victims to sit there and be like, okay, all these things, like I can just magically, turn my life around just like that. All these things will just be cleaned up just like that. And I think they themselves feel like either they can't do it, they failed, and they don't want to start, or that they feel like pressured by the service providers and case managers, like, well, why can't you just change, or things like that, right? So we do talk about the importance of aftercare because it's so important, because they're dealing with so much. But we can only do so much with so many people in the aftercare field who know how to address that. But the more important piece is not the rescue aftercare, and we don't even like using the word rescue. It is all the prevention things upstream. Let's start addressing all these things before they come down that river. I think this is where mental health really helps out a lot more, because you're dealing with all these things in mental health before they come down the line. But again, I wish I can talk to you about why mental health is important. And how, things like, and also on top of the layer of why there are so many kids who are trafficking victims today, and what are the things that's happening online, making those connections between traffickers and the minors online. And what, basically I see a lot of brainwashing that's happening in these kids earlier stage in the grooming process of it too. So mental health affects that.
I want to come back to that in just a moment. I think that was a really important point. It transitions to the flip side of this. We're talking about the mental health impacts of experiencing being trafficked, right? But the flip side of that we've talked a little bit about too, Lynn, we'll come back to in just a minute. I want to connect with Cassandra, but that is that there are also, like in so many other areas, an untreated or undertreated mental health condition, or the early symptoms associated with the development of a mental health condition can also represent vulnerabilities or risk factors for human trafficking, just like it can for housing insecurity, or other health related issues, or other forms of being victimized. So Sandra, I did see your hand. I want to connect with you, and then we'll come back to that. But did you have something you wanted to ask or add to the conversation, Cassandra?
I did. I just wanted to put out there that, advocating for the importance of the peer training, right? Since I know that there is this trust deficit that goes on, and understandably so. And so I think that's why it's so important that we're teaching those with lived experience how to, approach this peer to peer, rather than, with any sort of individual mental health care counselor that, has some sort of implied authority. because that can be extremely intimidating and inefficient and, and a lot of times re-traumatizing. So I had put in the chat that, Recovery Education Institute has a great peer. I actually took it myself, even though I'm a licensed clinical social worker, I took their training and I found it to be amazing. And there is a scholarship option when you're filling out the paperwork, and pretty much, I guess, everybody gets accepted for it, but you do have to have lived experience on your own with either mental health or substance use or both. And I found it to be very efficient, and I love where that's going. I think that peer to peer is the way to go, and that's the wave of the future, right? Is giving tools to those to empower the entire population that's being affected rather than armchair sociologists, psychologists, and social workers, right?
Yeah. Thank you so much for that, Cassandra. The human trafficking movement is very big on survivor-led in terms of the work, and the peer in this in particular it is really important. We will also want to help develop the victim survivor-led movement because it's not just about wealth of information. We have found very quickly that doesn't matter as a victim advocate or a case manager or a therapist, is that they already assume that the professional field has no way to know how to relate to what's happened to them. And so they already write us off before they meet us. And so, but then their peers, especially peers who they see as mentor, they will more likely listen to peers who have lived through that experience, and it's like you know how hard it is. Like I just can't change why I can't just go back to school just because I'm 16 years old and I should go back to school. And so that's something why I think that knowledge, peer-to-peer is great, but at the same time, as victim advocates, when we work with our population, we want to be victim-centered, and then some have expressed they want to be mentors, but they're not ready yet. So you also don't want the thing of like almost like the blind leading the blind, right? So they express that, and we want to encourage them to get there, especially if they want to help, because they know that, oh, if I had somebody who had that lived experience as my mentor, probably would help me, a lot more moving through the process. But we don't want to re-trigger and re-traumatize, and they're not ready yet in that space. So that's kind of where the space that we're at with this population in particular, where there is a very strong need for survivor-led mentors, but there really isn't a lot yet. But I think we'll get there, as long as I think the movement will get there, and then the victims who didn't see themselves victims before know that they're getting a big community support around this issue. But thank you, Cassandra, for that.
That's great. And also, may I thank you. I see some of the other resources that you shared in the chat. So coming back to Lynn, the flip side of the question, right, is in what ways do you find that having an untreated or undertreated mental health condition or that kind of thing will lead to a kind of vulnerability or a risk factor for trafficking, much as it might for something like housing insecurity or financial insecurity or other concerns?
For mental health in particular, well, I don't really like generalizing, because again, we're so like, well, it's a case by case basis, but just for the purposes of this, what we see is, what I've seen over the years is for our American sex trafficking in particular, whether it's adult or minors, because usually the trafficking adults start off as minors. So isn't also I turned 18, and something happens. So all those things again start off when they're minors. So we see the same thing, between the minors and adults. For American sex trafficking in particular, the thing that we see very similar, and the repetition, is that they come from abusive homes, dysfunctional homes. Most of them come from the child welfare or foster care system, which makes sense why they don't like anything related to the system anymore, whether it's the criminal justice system or social services system, because of that experience in the past. And because of that, their vulnerability is need for love and family, because that was not there earlier in their life. And then the sex traffickers come in, and then they're very good at building and making that connection. So what we end up having is a lot of trauma bond, right? And so they believe they're doing this out of love and making that connection. So the biggest misconception is that these are kids just walking down the street and they get kidnapped, like in the movies. That is absolutely not what's happening. If that was what's happening, you would be hearing all over the news right? And that's not what it is. So that's why when we work with American victims, especially younger ones who have that trauma bond with their trafficker, it's incredibly difficult to break that on top of all those other complex trauma, because from their point of view, we are removing the only person who actually cared about them in their life, right? And so that's what we're dealing with in terms of our Americans in particular. Again, it is not their fault because of what they have learned, right? So early in their life, their abusers were somebody that they thought was supposed to protect and love them. So that it just makes that connection. It wasn't necessarily a stranger, right? And so again, that's like, well, so when we talk to our American victims, they're like, well, we're here to help you. Well, what I probably should have had was help when I was a kid, all those, not 20, 15 years down the road, I've learned. That's why they were like, I survived on my own. I figured out how to make it. I don't need your help anymore, right? So that's what we were working with. And now we understand. So if this was just one victim who had this, but it's not, it's almost a lot of our victim survivors clients who really have very similar stories. For our labor trafficking and our foreign nationals, it's a little bit different. Not to say that it's they don't have those same elements earlier on in their childhood and with family dynamics. Is that for labor trafficking and foreign nationals, the exploitation and how they got into is similar in that the connection was made by identifying what was their weak point, what was their vulnerability. And for labor trafficking victims, their vulnerability is that they usually come from poor families. And so what they're doing is they're looking for a job opportunity in order to provide for their family and their children back home. So the exploiters and traffickers look for that weak spot and offer them a job, and they come over here and then they get exploited. So to summarize it, in order for this to work, you don't really need to you're not physically forcing someone by kidnapping them or tying them up or chaining them up. If you can get into their mind, then you can figure out how to control their bodies and their movements by identifying what their weak points are, right? And so that's prey and predator kind of tactic, right? So, in parallel, when you look at child abuse victims, most child abuse victims are not abused by a complete stranger. The vast majority are abused by somebody that they knew in their life. So those grooming elements of trying to identify what those weak points were around that child. So it's similar in that aspect. I don't know if that answers your questions in terms of the vulnerability in terms of mental health. Yeah,
it does. I think it speaks to again the kind of complex nature of the situation, because some of that vulnerability has to do with early trauma and the early attachment wounds. It's this inability to rely on their caregivers to provide the necessary comfort and support and care that they need, right? And so that need doesn't go away.
Yes.
But when somebody finds that vulnerability and exploits it, learns how to exploit it, that creates a risk factor, right? But at the same time, an untreated or undertreated mental health condition can exacerbate that same thing. And it also speaks to, the flip side, we were talking about earlier, that a mental health provider who's working with someone who is a survivor, not only do they are addressing the complex trauma of the experience of being trafficked, but they're also needing to address earlier traumas, including familial traumas, for many, the trauma of being failed by the system earlier, as well as potentially let's say underlying in this case, but an untreated or undertreated mental health condition that might be certainly interrelated, but distinct from all of the other traumas they've experienced, right? And so there is certainly a really complex nature to what's happening. And so the mental health provider needs to be really mindful of the layers here. Something that also occurred to me, Lynn, and I'd be curious to hear your thoughts about this too, is that there's a kind of dark psychology at work on behalf of the trafficker, who is able to identify a vulnerability and then knows how to exploit and manipulate it, right? And presents themselves as someone who will meet these very real needs that the survivor has, right, before they're the victim, before they're brought into being trafficked. And so it strikes me that for mental health providers, we need to be really mindful of things of not duplicating that experience, right? It can be, we talk about the importance of self-determination from an ethical point of view for mental health providers, that we are supporting our clients in developing their own capacities to make decisions about their life, right? And so it can be really easy though, as a mental health provider, to just tell somebody, okay, well, you've got this going on, so you need this, this, and this, and we need to do this, and da da da. So things like informed consent and self-determination take on a new layer here for someone
Absolutely.
who has experienced
Yes,
this level of manipulation in the past.
absolutely. Yeah, and I think there's so much potential for growth for mental health providers and not boxing into like, this is a problem person that needs to be fixed, right? And so I think that's why kids in particular don't want to, especially kids who come from the foster care system, they're forced to have therapy, and it's like a checkbox. And they're not addressing really what they really want to address, because these are things that they're supposed to be talking about, right? In order to kind of get that checkbox done. And so again, it's interesting when we work, the advocates work with the clients, but the vast majority do not want to talk to a therapist at all. Whether part of it is because of just their experience in the past, or that they think like, if I go, then I'm the problem. Like you need to figure out how to fix me. And our advocates and case managers don't really approach it that way. It's just like what you said. It's, we try to empower them, give self autonomy back into their decision making in life that was removed from them. And which is a really difficult thing to do, because especially when working with kids, like, okay, well, there's a lot of safety things that we don't want them to make decision on the safety thing. And for us, like, well, how do we work around those conversations around safety when for them, that's been normal. Like, I've lived a very different life from you. So, but at the end of the day, we want to empower them. And because, whether at some point between go from 16 to 18 years old, they're going to have to learn to make these decisions on their own. But again, we find out that because of earlier in their childhood, these were not the conversations that we're having in their life. And so these developmental markers are really missing. And then we're really starting from the very beginning, right? In terms of just very basic things for mental health. And so, working with minors or victims, even a 19-year-old adult who feels like, oh, I'm working with a 16-year-old or something like that, or a 15-year-old, and expect them to be able to go to a regular 9-to-5 job, be able to be normal again. And so they don't feel like they will ever fit back into the quote unquote normal world. Because the only people that understand what they're going through are the victims who are in a trafficking situation, that they feel that will accept who they are. So it's not just about I can wake up at this, right? Or I can. So I think that's the biggest thing, I think, for service providers in any program to kind of understand, and don't underestimate the value of survivors and what they know about it, because they want the help. We have talked to many, they want the help and they want to help others. They just don't think that people understand what's happening in this world. And so that's kind of where we are right now. But
Yeah. We've talked about the limitations at this stage in the development of human trafficking as a field, in terms of robust trainings, at least here locally, that equip mental health providers to know the things they need to know to work effectively with survivors. But is there a place where you would think is a good starting point for mental health providers who might have interest in this area?
honestly, not we have the task force does have a healthcare subcommittee, and we're trying to build out that healthcare subcommittee to bring, like-minded peers within healthcare. And whether it's a nurse or a doctor in mental health, to kind of build that out. But at least for healthcare, I know there's heal trafficking, so that's a good place to start. I don't know how much it goes into mental health, but that is for a national wide organization for healthcare professionals. That would be a place to start. But for mental health in particular, not that I know of, where there is a place where you can start. For me, I haven't seen it. When I go to conferences and workshops, I just walk into anybody who's willing to talk about it from mental health. And there really isn't a big network around that. But if you find something, like, please let me know, because we're looking for that too, to build the expertise for our mental health professions here in Orange County. I've been to conferences where they reach out to us So and again, I think this is new to mental health overall. And so for locally, the task force or waymakers or those who are working outside of mental health are actually talking about human trafficking in these mental health conferences. And so we're hoping that when we do that, that's where mental health will take it to kind of the next level, where you get to teach your own peers about this. Again, like the learning about human trafficking, it's going to take some time, but not as long as you think it would be. You know, you can have all this resources you have, and the same thing with law enforcement. You know, as a victim service provider, I can have all these resources and connections to housing, or, you know, food, to transportation, gift cards, buying clothes, all these things. But if I don't know how to relate to my person that I'm trying to help, and them connecting back with me, those are useless resources just sitting there. So it starts at the very basic level, understanding this population. Once you do that, you build the rapport, you build the connection, you know how to work with them, and they learn to trust you with that, then they will open the door to other avenues. And it first starts with, do not judge them. Like, you know, again, because they think they're being judged, especially like, well, this is prostitution. So that's the first thing, of not judging them, and things like, why did you do this? Why did you do that? Like, why did you go back? You know?
Yeah. I'm seeing a lot of intersection between some really the foundational principles of helping professions, but especially in the mental health world, you know, some of the foundational ideas of what we call unconditional positive regard, but which arrives at non-judgment, right? And empathy, client autonomy and self-determination, and supporting that, and really being mindful of being willing to meet the client where they're at, right? And do the good hard work of finding them where they're at, meeting them there, and not running ahead of them, not getting behind them, but walking with them through the process. So a couple of things, just as we're running low on time, that I want to be mindful of for some of our attendees that might be helpful. So a number of our partners so are working with this age range, 12 to 24. A number of them are connected to schools, local K-12 schools, colleges, and universities. Are there things they should be watching for or mindful of when a student is coming and seeking help, but they either identifying early signs of kind of like somebody beginning in the early signs of being exploited, right? Or someone who is in this who is actively being exploited, who's actively being victimized, and then how they might begin to meaningfully intervene.
With kids, I would say don't narrow it down to the exploitation. Even the at-risk is just as important, right? And so for example, we recently put together an event for Human Trafficking Prevention Month, which was last month. And we had 500 students ages 12 through 14 from 3 school districts here in Orange County. We did that and it was actually an amazing event. And we picked middle school in particular for prevention. Because one, even if they're being exploited, they're not going to tell you that. And so things like that, like or we know that it's not going to work by calling them a victim or emphasize, looking into the exploitation. What we are getting feedback from the kids and these students and the schools is that the biggest thing for right now is they're struggling with relationships, whether it's relationships with family, relationships with friends, relationship with boyfriends and girlfriends. Now we're in this new era, relationships they're building online, right? So this generation of kids dealing with so much more issues than we did before the internet. Right. And so in bullying online, and so it is complex. And I think if we just address those things that they have not been able to talk to people about, but the thing is they're talking to their friends about, they're just not talking really to the adults about, because I think adults can't relate to the things that they're dealing with. But yeah, I think I would start with just, safety. When we talk to our kids in particular, if they identify anyone who's safe in their life. If you ask them, hey, are there people that you feel safe with in your life, and they really can't name a lot of people, I think that starts there. and build like a safety network around that, and then talk about, what, with if things come up in relationship issues, who do they tend to talk to about that? And if they don't like talking to adults, that's where you also, where you spread the education to their peers. So meaning, sometimes kids would be, well, I'm not a victim, but you know what? I would help my friend who is a victim. If they don't want to self-identify themselves as a victim, they're more likely to want to help out their friends. So that's how we approach it with the kids at this age. And the middle school is actually the perfect age to address a lot of these at-risk factors with these kids, because that's when they're starting to develop, like, attention with relationships at that age. And because they're exploring how to be an adult, right? But they're in between that stage. Well, I'm not a kid anymore, but I'm not exactly like, but I'm learning those stages of being an adult in life. And that's where they're not getting a lot of the things that they think they're getting, but they're learning from their trafficker, how to be in relationships.
Yeah.
I think we're running out of time, but anything else?
Well, let me just ask maybe, so as a final question for you. And so we're kind of asked the bottom three questions we originally talked about, so thinking about the work of the task force, at this point, what would be, how can mental health providers partner with the task force? How can schools and universities partner with the task force? And how can the community in general partner with the task force, even as an entry point?
Right now, anybody who's interested and wants to be part of the healthcare subcommittee, I think that would be a great place to start, just to have this conversation going and talk to others in that subcommittee and where mental health can take it. And schools, I think, with schools, it's the same thing with, anybody who is in the social services field or victim advocate field or law enforcement field, is that there is no human trafficking courses, even the basic one that is in the schools. So when we are working with people in the field now, the incoming ones don't have that basic knowledge. And so they're really learning about human trafficking and how to do work at the same time, right? And so which is incredibly difficult. So with the university and schools, that we need to figure out how to introduce some of these courses really early on into the schools, so they have some type of prep education training before they actually go into the field and start working with victims and survivors in the field. But again, part of it is that, like, well, who is going to teach this and things like that. But this is for the next wave of generation, it's really critical to have some of these courses into the schools, because that's going to impact the workers in the field when they enter the workforce.
Yeah, I could see a really valuable entry point.
Yeah.
There. Schools of social work, or schools of counseling, or marriage and family therapy,
Yeah.
or even schools of public health. So
yeah, and you all can talk about, what are the reasons why. Is it because it's, I think if you as, students want that and you prioritize that, maybe the schools would like to, bring that in a lot more, versus, like, if they don't see there's a need for that, then they may not prioritize that as a topic of education.
Right. And then how about for the wider community?
I think for the wider community, at least in Orange County, more awareness is good. But again, there's the awareness of just like, well, everybody in the community aware that this is happening, exists, and separate that from education, right? Education is a next level beyond just awareness. The education component is that I'm aware of this, I know what's happening. What can I do as a person in my particular job? What can I do next, and what are those feasible next steps that I can do? So I think that's where we're moving forward as a task force, not just like awareness. Okay, I have a victim now. I think something's happening. What can I do next for this particular victim survivor I'm helping? And again, that's where we're moving. That's kind of beyond awareness, that we can make those touch points for our clients. But again, like, if you talk to your friends or families and you bring up the word human trafficking and they have no clue what human trafficking is, and they talk about movies like Taken, or these movies out there, just debunk that myth right off the bat, and that is not what's happening, and just get and so I think we're there. It's just like, there's still a lot of people whose basic level of awareness is that version of human trafficking, and tell them, like, television, movies are your worst form of education. Don't get your education from television and movies.
That's good. Well, then, how can folks contact or get in contact with the task force? What's the best way?
Well, we have a website. Just Google Orange County Human Trafficking Task Force. That's the first thing will pop up. It doesn't even have to be the task force, but it's just Human Trafficking Orange County. And we're revamping that to be more resource friendly for, I think, all the service providers and the community. But that's a good place just to start. Yeah, and kind of go from there. And then you can contact through there and through the healthcare subcommittee and go to public meetings as well.
Great. There's a web form on their website just so folks know where you can send in an email. And I know often with websites, you send something to a web form and you're like, I have no idea if anybody on the other end has ever seen this. But
Yeah.
just so you know, I did that and here we are today talking. So they're really great about being responsive to that web form.
And everyone in this group, just send it to David and David can send it to me, and you feel free to send them my email information to contact me directly if there's further questions or connections.
Great. Lynn, thank you. This
You're
was really great. I feel like it's a really important beginning conversation, but I'm really happy to have you here. I'm really happy to be able to let folks better know about the work of the task force and for you to share your experience and the work of the task force with us. Anything before we wrap up and move on to our next piece?
No, so thank you. I appreciate you all listening to this topic, and hopefully we can build a more robust response system in mental health, because it's a really big need, and I really can't stress the importance of it, of what we're seeing, and we want to improve the services we have now, knowing that we missed it for so long for adult victims, and let's not miss it for the next generation of young victims that we're starting to see. Thank you so much, everyone.
Thank you, Lynn.
All right. Thank you. Have a good weekend.
Take care. Well, everyone, keeping things moving with our agenda, just a couple things. So updates for the coalition. Crystal, correct me if I'm wrong, no real big updates for the coalition at the moment. We've got a couple of community events coming up that we're excited about, but they are specific to particular schools and universities. We're doing a resource fair at UCI and one at Cal State Fullerton coming up soon. Shifting into then partner updates. So any updates for you all from the community? Just a quick note, wanted to promote the Hope Card project. There's a flyer. I think Crystal, you said you'd be able to post that in the chat. Yeah. In partnership with the healthcare agency and the Office of Wellness and Suicide Prevention. It's going to be a great event. It's coming up on February 28th. So this coming Wednesday from 2 to 4 p.m. at the Behavioral Training Center there over off City Drive in Orange. Right next to I always want to say the block, the outlets of Orange and Cal Optima. So if you know that area. Okay, and then I open up to you all. Anything, any events you all have coming up, anything going on in the community you'd like to share? Amanda.
All right.
I like the new do.
Oh, thank you. I had been a minute. Yeah, I just wanted to get on here and share a couple of the programs we have coming up in March. So we have 2 honest hours that we're going to be hosting on Zoom. The first one on March 6th is going to be with a group of our awesome peer mentors we have. So if any, young adults were curious about what exactly is peer mentoring, how can it help support their mental health journeys, we've got 4 amazing peer mentors that'll be with us to answer questions, share what their experience has been like. And then on March 11th, we're doing one on healing through art with Laguna Playhouse. So once again, some great conversations about how art is a fabulous coping skill for us, can help boost our mental health. And then also we have an art demonstration that we will be doing. And then our last one, starting in March, we are kicking off our LaughRx comedy workshop training. So we're hosting 4 trainings, so 1 per month. And we're going to be trying to teach, confidence boosting, how comedy can be a great relief for our self-care and also an avenue to share our mental health story. There'll be free food, a mini resource fair, and tons of great activities. folks are able to showcase their comedy at the end, though that's optional. So if anyone's a little worried that they have to, have a performance at the end, it's very much optional, though encouraged. So March 16th is our first one. We do have community spotlights during each of these. So March is highlighting the LGBTQ experience. April 27th, we have for teens and young adults. May 11th is the AAPI community. And then June 22nd, we have general mental health. Anyone can join any of these. Those will just be kind of the community spotlights for each one. I'll share the flyer in the chat, but if anyone has any questions, feel free to reach out to myself or I'll get you connected with our coordinator, Crystal. Thanks, everyone.
Thank you, man. I always thought about getting into stand-up, so maybe this is my chance.
You have to do it. I'm excited. Our instructor, Aiden, is fabulous. He is so much fun. So well worth it.
Nice. Thank you. Real quick before I forget, also Crystal just posted a link to a survey in the chat. Many of you know how it goes. This is how we make sure that we're doing the best work we can do and how we learn to improve and all that. So if you have a moment, really appreciate if you can fill out the survey. Courtney.
Hi, everyone. My name is Courtney Ramsey, she, her pronouns. I'm a community engagement supervisor with Planned Parenthood of Orange and San Bernardino counties. Kat Reyes usually attends this meeting and I'm filling in for her. But really awesome to be here. I really enjoyed the conversation. And one thing kind of connected to what we do at Planned Parenthood in our community education outreach team that kind of came up is actually California State, our comprehensive sex education, CHIA, California Healthy Youth Act, actually does require that students receive education on human trafficking specifically, once in middle school and once in high school. So that actually should be happening. And Planned Parenthood has presentations to help school sites meet that requirement, presentations that are specifically targeted for middle school and high school, because obviously the way we talk about that with those age groups is a little bit different than when we're learning about it as professionals. So we have a wide variety of presentations, though, in addition to those topics. If anyone has youth programs where you'd like someone to kind of come in and be a guest speaker. We also have presentations on, bullying, presentations on healthy relationships, as well as, classic sexual and reproductive health topics like birth control, STIs. And then some other things we have coming up in the month of March. We're going to have a virtual peer health educator training. This is for high school aged students. So if anyone works with high school aged youth who have questions about sexual and reproductive health and also want to be that resource for their friends, get the right answers for themselves, it's a really fun training that we do online, so it's accessible to anyone for where they might be joining. It's totally free. And then we also have a professional development series that we're doing monthly. Lots of really great topics coming up on that. They do have a cost, but we're also able to make accommodations if there aren't financial resources available. So definitely check that out. I put details in the chat, but really great to be a part of this meeting. Thanks for the really great conversation, everyone.
Thanks, Courtney. Great. Let's see here. Excuse me. Just draw everyone's attention. There's a few flyers in the, excuse me, tickle in the throat. A few flyers in the chat. From Courtney, I also saw from Cassandra earlier about REI, and then from Mr. T from, for Advanced OC. Do you mind commenting on what y'all have going on for a moment?
Yeah, thanks, David. And hello, everyone. Mr. T with Advanced OC. I'm glad I learned about this group. I think it came through OC Healthcare Agency. I appreciate them for sharing it. But at Advanced OC, we're hosting programming that supports the Black community. And we're partnering with barber beauty bosses, so barbers and salon owners, and having conversations, courageous conversations around mental health. And also the other part of the conversation is building strength and wellness. And so there's entrepreneurship opportunities as well. And we have, many partners that we work with. So in the chat, I've shared a couple flyers. We, have programming with, even also permanent makeup artists. So, the session that we're going to have next month in March is going to be at a salon where it's, going to be focused on self-worth, self-confidence, and we have permanent makeup artists that will be, having discussions with us about, how folks are, taking care of themselves and also both in their spiritual, mental, all the wellnesses. So yeah, please join us. The website's there, QR code's there. We have 2 workshops a month. One is virtual and one is in person. So hopefully you can join us for one of the sessions.
Fantastic. Love it. Great, thank you. And thanks for joining. Hope to see you more. Anybody else? I encourage again to go through the chat. There's some flyers there. If there's anything you'd like me to share, feel free to send it my way. We can put it on our website. Yeah, anything else before we wrap up for today? Well, it's good to have you all again. Our next meeting will be March 29th. And for now, oh, and the recording for this will be up within the next about week or two. If you want to come back and see it again or share it with a colleague. And otherwise, good to have you all. Thanks for joining us. Have a good day. Happy Friday.